So please take it away, Alex.
But I'm going to go ahead and share my screen. And I don't know sort of the familiarity folks already have with Ampersa, but certainly want to start sort of high level and give some information. So starting at the beginning with Bertha, I always want to begin with our mission, which is to connect all people in need to the programs that serve them with dignity and ease. And that's really referring to dignity of response and ease of access. So Bertha is an online platform for connecting yourself or others to free or reduced cost direct social service programs in your area. We're nationwide, so we have touch points across the country as well as in Puerto Rico, Alaska and Hawaii, of course. And anywhere you're at, really it's that quick call to action of typing in a zip code on ampersa.com or one of our other sites and trying to connect and find the information for meeting needs in your community, those community programs. It's completely free to use to look for help for yourself or for someone else. I'm going to do a quick live demo to sort of show what that looks like. And it's also free for organizations, community-based organizations, CBOs, to list their programs on Bertha. We offer a variety of tools for them to be able to maintain those programs, edit them, and just easily connect those folks into their existing workflow of intake for patients, new patients and clients. So we are a public benefit corporation. Again, we're nationwide, based in Austin, Texas. We actually sell versions of Bertha and work with larger organizations to help them meet the social determinants health needs of their community. So we work with several health systems in Colorado, some over there in Aurora, where we can actually have Bertha integrated into their EHR so they can make these referrals from their electronic health records, and then they can also customize their sort of sites that look like Bertha, both on a staff side and a community side, to get sort of aggregate information about what people are looking for and what programs they're searching for and how many people are connecting to these services. Useful metrics that help them understanding how they're moving the needle on social determinants. So if you're interested in sort of what customers are doing with Bertha, feel free to get in touch. But today I'm just going to focus on kind of our core ampersa.com platform and all the free tools to use. Sort of give a quick snapshot. We've grown a lot. We started in 2011 there in Austin, grew out toward Texas, and then across the country. So we have a pretty good adoption rate and network here in Colorado. And I'm working with organizations and community partners to continue to build that out. So you'll see 3.5 million users. In every part of the country, we'd have at least 875 programs. That's because Bertha indexes all the local, state, and federal. So we're trying to cast that funnel really wide to connect people with a wide range of resources. Just a quick snapshot of what we have on our platform for Colorado. So nearly 5,000 programs across the state. Again, organizations can list one program or they can list 20. So this is at a program level. We organize around that because it's more indicative of the service you're getting than the organizations and their names. About 43,000 unique users over the last year. This is July to July, conducting 164 searches. And this is both people who have logged into a free account on Bertha, and you have additional tools that they can access, or using our site completely anonymously, which is really helpful for people who don't want to put their needs out there or just looking to be able to access all this information without logging in. Here's a breakdown for Aurora over that same time in the last year of the needs. And this is really what's interesting, is to see in different communities across the metro area, by zip code, or across the state, what folks are looking for. Obviously, housing and food insecurity, affordable housing is always a big issue. Really overly represented, I think, here in the searches in the Aurora area. Denver Metro in general, housing is key. If you narrowed this down for the last several months, you'd see food increase a lot because around COVID, utility assistance, a lot of that. So we have insight, and our customers, for their searches on their site, have insight into what people are looking for. And this can be a great way to see where the gaps are and how they can continue to build relationships with organizations or fund organizations to meet those needs. Just wanted to mention real quick, we have about 50 people down in Austin who manage the data on the data operations team. All programs are vetted before being updated by 2 different people. So free or reduced cost direct service. So it can be a 501c3, a government program, church faith-based program, corporate social responsibility program. As long as it's either free or reduced cost or on a sliding scale, it can be on Bertha. Real quick, look who uses Bertha. That trifecta of a seeker, people we really want to encourage self-navigating of our site and our community sites so that folks can find what's out there and connect to programs on their own if they're not working with a resource coordinator, social worker, or a care manager. But then helpers, people who are either family or friends informally, or work as sort of a care connector, a care coordinator, use Ampersa to help make those connections. So they can refer people, either they're helping or themselves, to organizations. So they're a big user of the platform. And then of course, all those community-based organizations that are listing their programs and letting people know exactly how they should be connecting to receive services. All that make up a comprehensive nationwide social care network. I'm going to jump into a live demo, and I guess I'll save the questions for later, but please feel free to think about what you want to know. So right now, this is ampersa.com. I'm not logged in. I just, again, quick call to action. Where are you? I can type in that zip code in Aurora and go in and see what programs. So of all those programs here in the zip code, there's 1,800 programs. That's, again, local, state, and federal. I can either type in a keyword like food or mental health and just search by keyword, or I can use the navigation bar to sort of drop down and explore different categories. And you'll see if I go to health, mental health, there's all these subcategories with the in parentheses number of programs. So keeping it sort of current with COVID, I'm gonna go ahead and go to food and emergency food. Before I do that, I wanna highlight the site is actually translatable into up to 100 languages. So if people are looking for resources, especially in Aurora, supporting individuals who English is not their first language, they can translate the entire site, print and share resources in a different language. That's something sometimes people miss, so I want to make sure to point that out. But staying in English for now, going down to emergency food, I could drill down and see that they got those 12 programs serving this area. These program search results, these are all program cards. So that's how we term them. Going down, you'll have the program itself as well as the organization. If I clicked on Food Bank of the Rockies, I could see all the different programs they have listed on Ampersa. But again, we organize by program because that's most indicative of the service that people are looking for. So I could go down and scan sort of some different programs here. I could go and see sort of which is closest to that 80010 zip code. We're not tracking anyone's locations. You're not logged in. So we're just that midpoint of the zip code, how far from there these services are. And you can do it by sort of where you're at or by the relevance of the search terms. If you had like 100 programs for some other categories, this is really powerful and useful to be able to go in and open up filters and filter for the person you're helping or yourself what your life situation is. We have COVID-19 tags for resources that are currently sort of vetted and added around COVID. For individuals who are experiencing homelessness, there's not as many here because thankfully a lot of food programs are open to anyone in need, but for other programs, this would change. It's all dynamic, tapping into those key terms of who people serve and what they offer to be able to find that great match. Again, you could do that for the programs themselves, ones that you want to visit within 5 miles or ones that already have a scheduler appointment that you can sign up directly through the website. Then you can go over and say free or reduced cost. Again, those are those 2 options. Sort by language as well, providing services in different languages. So really helpful when you're working for someone, instead of just saying, here's 1,000 programs to go through, finding those fine-tuned criteria to get down to what they want. And then finally, income eligibility, being able to add if income eligibility is a factor, the federal poverty index size for the family, and then being able to see results that way if applicable. So going down just real quick, I'm going to focus on one. So we see here the Aurora Interfaith Community Services Food Bank. We'll have a brief description. These are those tags that connect to the search results when people are looking for those categories or those search terms. It will find the program and the results via these tags. Organizations can go in and edit those based on how their services change. And then who they serve, anyone in need, or if it's more specific down to veterans, anyone over 18, they can fine tune so it matches people with the programs better. And then they can always open more information. And this is where you really start with eligibility. That's most important for us. The availability, so whether they're actually available to receive new clients, whether they are on a wait list, temporarily closed, these can be set different ways. Fuller description of the services offered in this program, and then more information about those language, those costs, some social media or website links. And then you can print this out to share with individuals. You could also come in here and click on share and share information about this program via email or text message. Again, if you translated this site, it would share in that language. If you log in, the two sort of buttons that are accessible to logging in, and you can create a free account, you can go in and actually save this as a favorites in your favorite folder. And that way you can customize maybe the 12 to 20 programs you refer people to or share on a regular basis, and have a single link that you can either share as a URL or email. So they'll get all those programs you regularly share out. The good thing about that is they're constantly being updated, and when it's sent out, it has the most up-to-date information that we have. And you'll see here in the more info, it shows when a program was last updated, which is helpful. Our data team updates programs every 6 months is sort of their goal, but we definitely work with organizations to try to get them to claim their programs. And that just means a free 2-minute process to take control of that listing. You'll see a program's claimed by having that little check mark. They'll have direct access to set up the program how they want, change any information as needed, and then choose how those next steps appear, what they want people to do. So I definitely encourage, if you're working more in a helping capacity, to save those favorites folders for easy access. I used to work at The Gathering Place, which is a great organization on Colfax for homeless women and children. We would always have paper handouts that we try to update once or twice, 1 or 2 months to make sure that information was current, and we were always falling behind. So this way, in a digital world, you can still print that for people who want to have that tactical touch point, or they're not digitally literate or have access to the internet. But you can also send those via phone or email, and really make sure you have that information, the latest that we have on our file. The other thing I want to note is you can go in, if you have an account, and leave notes on programs. So if you're going in and you work with this organization, you can leave and share notes with your team or people who are on your account to say, this is sort of some insider information. It's great working with Maria, or tell the client to always bring their ID. Just institutional knowledge that maybe you want to make sure everyone's on the same page about for a particular program. And then we do crowdsource. We really encourage people, if they interact with a program, especially if they're not claimed, and something is out of date, let us know. Shoot our data team a quick message, and they'll get that updated in 1 to 2 business days. So I think it's a great way to sort of tap into the community resources and things you already know about. So that's really information. The next thing over here are these next steps. So it's not just about indexing all the programs as the yellow pages online. It's what should you do next once you find a program. For some right now, during COVID especially, it's just a call and schedule an appointment. People, maybe office is closed, call a number. For others, as I mentioned, it's to actually apply on their site. They have an existing intake form. That's what we're going to link to. And when they claim, they can set that up how they want. And then we have other tools on the site that Ampersa offers for free, like free appointment scheduling. If an intake appointment is the first thing that you should do, people can set that up. We work with Connect for Health Colorado, and all their health enrollment assisters use Ampersa scheduling to connect about 14,000 appointments every open enrollment. So here in your zip code, ACAN has this, and this is what it would look like for any program that uses our free appointment scheduling. You can actually go on and book appointments directly through Ampersa. So if that's the way the program's set up, that's what they point people to. Or we have other things like an eligibility screener, where you can answer some basic information to see if someone's eligible and give them an automatic reply. No, you're not eligible for this program, but here are some other resources. Or yes, here are the next steps. It looks like by your answers in a simple Google form, you do fit the needs for eligibility. And then finally, the last thing that we have is one-step referrals. So if I wanted to go in and connect a Warms Night, if I'm experiencing homelessness, I can go in and, for myself or someone I'm working with, send a referral that will go to that program, and they can have that sort of as an intake dashboard through Bertha and update statuses of how people were helped. So it's up to those programs to work to find out what they want people to, how they want you to connect. So it's really a great tool to just help build efficiencies of connecting people looking for programs and folks who are providing services. So that's a real high overview. I'm probably way over already. I'm going to jump right back and sort of mention again some things you can do on Ampersa, using that to search for available programs, share those programs one at a time or a batch of programs with your saved favorites folders, connect to those programs, either a referral screener or a scheduler, actually making those connections. So that's where the dignity of a response comes in. We want to make sure people don't fall through the cracks and get them connected to programs proactively. You can add and manage your own community program listings. So certainly go to Ampersa and see if your programs that you provide in your organization are listed. If not, at the footer of the page, there's a link saying suggest a program, or if you're on there to claim a program, would love to connect with you and have you set up to be able to access all these free tools. And then we also have reporting analytics. So you can see how your program is being interacted with on the site, how many people you've received referrals to, and some outcome metrics, which is really helpful for sort of, these community-based organizations to show in a board presentation or for grant funding. So that's sort of it. Definitely would love to connect with you offline. I'll share my information, spread the word about this free resource. We have this really cool simple search box. I know I've talked to some about it. Putting it on your website will actually let people type in their zip code on your resource page, for example, and jump into Ampersa to access our entire network. So it's a great way to connect people to our entire network and not have to include all those updated links during COVID on a resource page, or to supplement those links you have for your community partners. So at that, I'll leave it to questions, and thank you so much. Here's my information. I'll also chat it in the chat box so you have that.
We do have a few questions that came in through the chat. One question was, how are organizations highlighting their connection with Ampersa through their own, promotional avenues?
Yeah, so for organizations, sometimes that touch point of having the simple search box is really helpful so that they can link directly. If they have a scheduler or they have a screener that they're using as sort of a one-take appointment or intake process, like down in Austin, we work for the Coordinated Entry, ECHO, the homeless organization. So for continuums of care and Coordinated Entry, they have a single Ampersa form that everyone goes through. So that you could find them on Ampersa, but they could link to their screening form on their website, in a newsletter, anywhere that sort of brings them to that page to start that process of connecting through Ampersa. For other programs, that's not really the case. For food pantries, they don't want to overcomplicate it and set up referrals or appointment scheduling. They just say, hey, we're open Tuesdays and Thursdays, 10 to 11:30. Bring your ID if that's what needed right now. Thankfully, a lot of food pantries are doing away with the sort of resident requirements, but we don't need to overcomplicate. So it's different for each program. And so that's why we want to meet them where they're at and provide those tools.
Thank you. We did have another question, just a couple more minutes. What percentage of organizations claim their listing? Is every 6 months frequent enough to update the listings? Are you finding that organizations are doing that on a regular basis?
That's a great question. And that's the rub, right? Is having the updated information. So with 350,000 program locations across the country and a 50-person team, they're definitely doing some awesome work. But no, a lot of times information, especially around COVID, changes more frequently than every 6 months. And so I'd say in claimed, Colorado is pretty high. I think we're at about 25 to 30%. And that's my big part of my job, is to help educate about the platform, work with organizations to see where they're at and how they can use Ampersa to help support them. And I really tell them when I set it up, the big information, if the phone number's out of date, website, address, you close the day of the week that's listed there, those are really important to pay attention to. Our data team's going to work on that. But you don't need to change every single nuance if it's not going to be a real deal breaker. What I suggest is how you set it up. So with larger organizations, I always have them set it up with someone like maybe a program manager, communications manager. They understand how all their programs are listed on Ampersa, and then they add their colleagues to be able to update individual programs. So you can add and invite teammates on these free accounts to manage your claim programs and say, I'm going to give you access to this specific program to this individual who's the program manager, and they're focused on that. But leaving one person at the organization to kind of have that overseeing insight into how they're working on Ampersa. Because then when there's individual program turnover, it gets lost lost and maybe they're sending emails to a dead email. That's what we don't want. So it's really how we work and set that up from the beginning. So that's what I'm really here to help onboard people for that, and then continue to just check in and build those relationships. I also really think that there's a lot of quality information, especially for people who receive services themselves, to add to those suggested program updates. It's a pretty light lift. Just say, hey, just connected with them, they're closed. That goes in 2 days to get updated. That prioritizes those changes we need to do on our data team. So I really want people to encourage them. If they know something's out of date, don't be shy. Reach out to me directly or use that. I like how they've used that crowdsourcing model to tap into the shared sort of understanding on the ground.
Great, thank you. We have one more question and then we'll go to our next presentation. How does the work that you do overlap or coordinate with the state health information exchange effort?
Great, and I have to remember who I'm talking to here. Many people are probably aware the state of Colorado is exploring the social health information exchange. In some places of the country, they call it a CIE, or community information exchange, like in San Diego, really trying to connect health data and the HIEs with social care and community providers, and how to track and manage some of those social referrals to make sure people are moving the needle on needs outside of the clinic and doctor's office. So Ampersa, we definitely have our strengths. Other people like Mile High 211, the HIEs themselves, they have other things to bring to the table. So they have some grant pilots right now. We're involved in some of those. It's really about how we can work together. I know in some states they have an RFP where they're like, this vendor, this platform is going to win the day. Here in Colorado, the conversation's more been, these things have popped up organically, maybe on the western side of the state with Quality Health Network or with Carrillo and on Front Range. How can we use what's already happening to talk to each other? How can we share that data and make it a little more organic, where we bring those systems together instead of mandating one? So we're involved in those conversations, and I'm really excited about where they're moving. It's a slow process, right? It's a very complicated issue to solve. But I definitely am excited to be involved in those, and think Aunt Bertha does have the technology and some things that we're offering that can really help make a difference. So. Great, thanks so much. I'm going to type in my information in the chat. Again, feel free to connect. I'd love to learn how your organization is currently dealing with referring people and how you might want to use Ampersa. The good thing about Ampersa, all the technology things I'm talking about today is free. So it's just about picking and choosing what works for you and your clients and your program. So happy to chat. Thanks again for having me on. I appreciate the opportunity.
Thank you, Alex, for being here. We really appreciate it. And for those of you who have just received the corrected link, we are recording this presentation, and we will be sending it out to everyone who's registered. So don't worry if you've missed out, you'll have another chance to watch Alex's awesome presentation. Next up, we have Angie from All of Us Research Program.
Thank you, Julia. Hi, everyone. My name is Angie Gonzalez. Mel, would you like to share for me? Okay, so my name is Angie Gonzalez, and I'm with the All of Us Research Program, a National Institutes of Health initiative. I'm joined by my colleague Mel Lopez, who you just saw wave, who will be running the show behind the scenes for me. Thank you all for letting me talk to you today for a few minutes. Before we get started, I wanted to go over a few of the features of Zoom that we'll be using. It looks like everyone already knows how to mute themselves. We will have the Q&A at the end, so if you guys want to enter the questions into the chat, that's at that chat bubble button in the middle on that bottom bar. There are also fun reaction emojis that we might ask you to use during this presentation. So if you'd like to also silently clap your hands or give a thumbs up, you can do that there. During today's presentation, we'll discuss what the All of Us Research Program is, how you can get involved, and how improving the future of health can start with you. First, we're going to kick things off with a couple of poll questions. You may unmute yourself to answer the polls or use your emojis. Raise your hand or say aye if you think high blood pressure is something that can be passed down from one generation to the next. So high blood pressure can be hereditary. It means it can be passed down from one generation to the next. In fact, high blood pressure runs in my family. My mom and my uncle both have it, and I know the cycle will only continue unless we can get the research done to get some questions answered. Now, who wants their medical providers to give solutions and treatments that are specific to you as an individual? Click the clapping emoji for yes or say aye. Yep, it looks like the majority of you agree, and so do we. Before I share information about the research program itself, I'd like to set the stage by providing a little background on health research. Health research is the process of finding out new things about improving people's healthcare, and people who conduct health research are identifying better ways to keep us healthy. This is the foundation of the All of Us research program. The goal of All of Us is to provide researchers with information that might help them understand more about why people get sick or stay healthy, and to advance precision medicine. With this research information, we can uncover more precise and targeted healthcare treatments for diverse groups of people. The program aims to really engage a community of participants that reflects the rich diversity of America, including many people who haven't taken part in research before. Participants can be from any background, gender identity, sexual orientation, and health status. Because health research can only help people of all backgrounds if people of all backgrounds get involved. According to the NIH, only 10% of people even participate in clinical studies, and the majority of those participants are Caucasian males. Hispanics make up 16% of the population, but are represented in just 1% of past studies. I'm half Puerto Rican and half Cuban, and as a Hispanic female, I'm part of that underrepresented category, being Hispanic and being a woman. But this program gave me a chance to be included and to have a voice in research. To date, over 350,000 people have joined. Our goal is to get 1 million or more. So what is precision medicine anyway? Precision medicine research considers things that make everyone unique. It's also a fancy way of saying research on healthcare tailored to you as an individual. It focuses on the differences in our environment, like where you live, our lifestyles, like what you eat and what you do, biology, your genes, and family health histories. By studying these differences, researchers may find patterns. This may help improve health for everyone. I mean, I have a fraternal twin sister, and even though we're genetically similar, I swear by Zyrtec and she swears by Claritin. Whoa, does this slide look blurry? Yeah, sure does to me. We'll talk about why in just a second. Raise your hand if someone you know wears prescription glasses. Right? About 14 million people in America, age 12 and older, have self-reported visual impairment, which is defined as 20/50 or worse. Here, we can see a collage that represents how someone with 20/40 vision would view it. However, apply prescription glasses, AKA precision medicine, and it goes from 20/40 to 20/20. Prescription eyeglasses and hearing aids are two common examples of precision medicine. They're custom solutions to individual needs. Now let's chat about something that's important to all of us: data security and privacy. It's a top priority in the program, and we use the latest technology to help keep your data private and safe. The NIH is committed to leveling the playing field so a diverse group of researchers can participate. Your identifiable information, like your name and address, are stripped away from your samples, and you're assigned a unique code. And all survey and personal information are kept safe on an encrypted server with limited access. The program even has certificates of confidentiality from the government to help fight legal demands to give out information that could identify you. And always remember, participation in All of Us is voluntary, so you're free to share as much or as little as you feel comfortable with. I joined the program because I felt my information was safe and secure, and I liked that I could access it at any time. Okay, let's pause and see what we've learned so far. We mentioned earlier that precision medicine focuses on the power of 3. The differences in our environment, like where you live, lifestyle, what you eat, and your biology, your genes, and family health history. By studying these differences, researchers may find patterns, and this may help improve health for everyone. Let's see if we can determine what is considered lifestyle, genetics, and environment factors. I've got a collection of phrases here on the screen, and I'll just read one at a time, and I just want anyone and everyone to say the answer out loud, or you can type it in the chat, and then we'll see if you're right. So please unmute yourself to play. Okay, so I am left-handed. Is that genetics, lifestyle, or environment?
Genetics.
Genetics.
Genetics. How about I have experienced a natural disaster?
Environment.
Environment.
I eat breakfast every day.
Lifestyle.
Lifestyle.
I promise these get a little more difficult. I drink tap water.
Environment.
Environment.
Yes, so we have it here under environment, but in certain cases it could be under lifestyle if, you know, because your environment can dictate your access to clean tap water or your need for bottled water. I feel stressed often. Yeah.
All the above.
Right. So this one could fall under any of them. Here it's under lifestyle because of how different factors of how you live shape your stress levels, like your job. It could be genetics if you're genetically predisposed, or your environment if your environment causes you stress. I have naturally curly hair.
Genetics.
Genetics. Yes. Well, I hope you guys enjoyed that little game and now have a better understanding of the different factors that go into precision medicine and how each one truly does impact your health and make you unique. We have a chance to be represented in research that can benefit us all individually and collectively. I'd like to show you why the program is important and what it means to others in a short video.
We need to be represented. We need to be part of this medical breakthrough. There is a lot of information that hasn't really been taken into account in terms of genetics, in terms of where people come from, what they've been through.
I didn't really think much about medical research until I heard about All of Us. Then it made me think like, oh yeah, like, I don't think medical research is really focused on minorities or Latinos.
We're all in this together as humans.
So now you're probably wondering, what's in it for me? Well, it's simple. You'll contribute to research that may improve health for generations to come. There's no one exactly like you. I mentioned earlier, I have a twin sister, and even she isn't exactly like me. Your unique health data may help researchers find the next big medical breakthrough. All of us is dedicated to better health, both in the future and today. For example, to learn more about the ways COVID-19 is impacting our participants, the program created a survey called the COVID-19 Participant Experience, or COPE survey. And once you go through the All of Us enrollment process, you can participate in that survey. It asks about people's experiences to learn more about the ways this pandemic is impacting participants' physical and mental health. And the effects COVID-19 have on your physical and mental health may change as time passes, so the program will invite you to complete the COPE survey once a month for as long as this pandemic lasts. Hopefully not too long. Every month, your new answers will matter, and your participation in health research may lead to more precise care for treating specific diseases. So how can you get started? There are 2 ways to join. You can visit the All of Us website at joinallofus.org/connect. There you can learn more about the program and sign up to receive our newsletter. You can also download the All of Us Research app in the Google Play or Apple App Stores. Once downloaded, you can create an account and get started. You may notice there are 2 All of Us apps in the Apple App Store. Please be sure to download the one named All of Us Research with the all-white background created by Care Evolution. Once you create an account, You'll give your consent to enroll, agree to share electronic health records if you choose to, answer health surveys, including the COPE survey, and you may be asked to order a biosample kit like blood or saliva. It gets mailed to you and you mail it right back to the Mayo Clinic. It's so convenient. Okay, I'd like to ask everyone to please get out their cell phones and open up your cameras. Go ahead and scan the QR code that you see here. It'll take you right to our website at joinallofus.org/connect, where you can sign up and also receive our newsletter. I'm going to also type the website in the chat so you can copy and paste the URL into your browser. All of Us is the largest active data collection effort, and it needs you to help find answers to some of our biggest questions. I'd like to thank you all for your time today. If you'd like to learn more about All of Us, again, please visit joinallofus.org/connect. We would like to open things up for some questions, and we can start with them if there's any in the chat. And feel free to unmute yourselves. We can see if we have any questions.
Are the saliva sample kits free?
Yes, so when we say order a kit for the Mayo Clinic, it's just creating an order online, but there's actually no fees involved in joining the program. Any questions, comments, concerns? Okay, well, if there are no more questions, I'd like to thank you all again for your time. I hope you enjoyed learning about the All of Us research program. Once again, if you'd like to learn more or sign up, please visit joinallofus.org/connect. You can also find us on Facebook, Twitter, and Instagram at All of Us Research, and YouTube at All of Us Research Program. Don't miss out on your chance to help change the future of health for all of us. Thank you so much. I'd like to thank Rural Health Alliance for having us. And if anyone has any questions, please let us know. Otherwise, have a great day and thanks for listening.
Thank you, everyone.
Thanks so much, Angie. We appreciate it. Joe, was there any more questions?
We did have one come in that just said, how can we help promote this for you, and how do you, what's the best way that you found in promoting and spreading the word about what you do?
So we have over 100 partner organizations nationwide, and we have different avenues that you can take. One of the easiest right now is doing kind of what we're doing right now. We have this virtual ambassador program. We used to travel nationwide all around the US doing this. Like Mel and I are actually lead tour managers on a mobile exhibit. There's 2 exhibits that go around the United States, but during COVID, they've kind of halted all of that face-to-face stuff. So we used to be part of that community education and outreach. And what we're doing now is we're hosting these virtual presentations to kind of take the place of our face-to-face interactions we used to have with people and still get the word out about the program. So we're just reaching out to people who might have the same mission of wanting to serve the underrepresented communities, want to give people a chance to have a voice in research. And we have these presentations that we do. And then we also have electronic toolkits that we send out. If you want to do a presentation, it's kind of like a virtual toolkit that you can use in emails and newsletters and blast out to any members or groups or partner networks that you have. But I'd say the best way right now is the virtual ambassador program. And then I can also send some information to Mandy about becoming a partner.
Great, thank you.
You're welcome. Thanks for the question.
Thanks, Angie and Alex, and thanks everybody for participating. Again, we apologize about the technical glitch that we had today, but like I said, we have recorded this presentation, so all of the registrants, we will receive the recording. Thanks again, everyone. Joe, do you know when our next SDOH intergroup meeting will be held?
I believe it is in November, November 10th at 1 o'clock. The
Okay.
next meeting.
Hope to see you all in November. Thanks for joining.